The impact of our vaccination program on rubella has been huge. In fact, around the world, rubella has almost been eliminated, especially in the developed countries. Many of us don't even know what rubella would look like because we have never seen it or encountered it before. So what is rubella? It's commonly known as the German measles. In fact, it comes from the Latin word meaning little red. It's often a mild disease and really goes unnoticed. It lasts for about 1 to 3 days, has a red rash, some swollen lymph nodes, joint pain, and fever. But as stated, it's only mild, so why do we actually have a vaccine for it? Well, the main goal of immunization, which we've been so successful at preventing, is rubella being contracted during pregnancy. If it is actually, if you get it while you're pregnant, the results can be devastating. It can cause miscarriages, stillbirths. It can cause malformations of the eyes, of the heart. It can cause deafness, mental retardation, and permanent brain damage. As such, we're very happy that we've produced such a successful vaccine. In developed countries, we still continue to progress towards complete elimination of rubella through pregnancy, as well as our great screening programs. However, in the 2 decades following the introduction of this vaccine, epidemics still continue, primarily in unimmunized populations. It can also still occur in immigrants traveling from areas where they have low rubella coverage, also for people who are pregnant and they travel abroad in these same communities. As such, we strongly recommend childhood vaccination with the Rubella vaccine. It's a live virus, but the great news is it forms immunity in over 97% of people that we give it to. It's usually combined with measles and mumps in the MMR vaccine and routinely given to kids around their first birthday, and a second dose is given at about 15 months or any time before school entry. Serious adverse events are very rare. And as stated, there are absolutely no connections between the MMR vaccine and autism. The most common complication that your child might get if they get the MMR vaccine are a little rash and some swollen lymph nodes. They can actually also get some joint pain that occurs about 1 to 3 weeks after immunization, but this goes away. We can treat this with some over-the-counter analgesics, or otherwise known as acetaminophen or ibuprofen. So overall, it's been a success, and we certainly recommend the Rubella vaccine.